Hey, welcome to the Fatherless Cheat Sheet. And today is a little bit of a, I don't know, not off topic, but a little check-in with a good friend of mine who happens to be a colorectal surgeon. So obviously my 13-year-old brain is running rampant with jokes and things like that. And it's sort of hard to reel that in. I'm a huge Adam Sandler fan, and I'm trying not to harness the Sandman in all of us right now, because it is kind of easy to go the immature route and have a little fun with some of this stuff. But it is a pretty serious topic. And why I wanted to talk to him was there is to me, a connection to having that discomfort with medical professionals, or if it's not sort of normalized or regulated in your home, or if you don't have all hands on deck, do things fall through the cracks? No pun intended. See that? I couldn't help myself. You're preoccupied manning the ship yourself, not having that other person to bounce things off of, or if their attention isn't exactly there, do those things manifest in a negative way medically? Can you take your eye off the ball? See, I did it again. But anyway, so very quickly, one of my first experiences with a real issue medically, I was a baseball player, and I was about, I would say 11 or 12 years old, probably 12. And I was a bigger kid. I shopped in the Husky Section, and shopping in the Husky Section is like a cream-filled barnacle that will stick to your psyche forever. That's a real thing. And you just can't get rid of that thing when you shop Husky, because you got to let that suit out, because you just got that boiler. You got that premature boiler, get that belly and them handles. And it just so happens that I had 2 cracked vertebrae. The contributing factor was that I was sort of an out-of-shape kid. It was what it was. I enjoyed my apple juice and my mozzarella sticks and my Saved by the Bell, all my comfort spirit animals when I got home. As a latchkey kid, Mom was working hard. I was watching, sort of taking care of myself, and it is what it is. But I went to a doctor, and that was an experience in and of itself. She was a very well put together professional person. And I just remember my mom in the room with me, and the doctor, for some reason, I don't know what possessed her to do this. It seems superfluous to me, thinking back, but she decided to share a piece of information about my burgeoning anatomy with the room. And I just remember just being so internally devastated by that, because it was my mom in the room with me. Now I know that if it were the other way around, and if it were a girl with her father, it would be a similar situation. But I just wanted to talk to my friend, Dr. Farshad, to get a little insight on how that could maybe manifest, how those single parent households, or not having that full all hands on deck thing, was it more than just me that felt a little uncomfortable? And I'm talking the level of discomfort with this thing, and sorry, Mom, because she's going to listen, but the level of discomfort of that moment, enough for me to remember it 30 years later, was akin to watching the highlight reel of The Sopranos and Game of Thrones all put together with both of your parents sitting between them on a couch. That's how uncomfortable it was. And I think you all would know what I mean by that. But the result of that was that those cracked vertebrae, what I then had to do, which this gets even more cartoonish and ridiculous, I had to wear a back brace. I had to wear a back brace in my, I think it was 8th grade. An awkward time. Things are, as the doctor was happily telling my mother, things are growing and not growing, this and that. And I had to wear a back brace. I had to have this thing that was like the front end of a small sedan. I had to wear this thing to a Catholic school who prided themselves in their strict uniform policy, because they were really wonderful people and so understanding. And I'm sure that the person who ran that school, I'm sure there's a chair for him between Mother Teresa and the poker playing dogs up in heaven, just waiting for him. And if anybody knows who I'm talking about, let's hope that the chair is reinforced and there's plenty of Diet Coke. So thank you. That school was so wonderful and understanding for that whole situation. But just imagine a 13-year-old boy who's struggling with things, as it were. I had to wear this thing, and what I would do is I would throw on sort of like a double X sweatshirt made for like a novice competitive eater. That's how big this sweatshirt was. And I'd wear it to school. So not only am I the kid in the thing that's sticking out like the front end, and I've got the sweatshirt, but I'm out of uniform. So everybody else is pissed off because I get to wear something that's not this polyester piece of absolute garbage with this fantastic clip-on tie that I didn't have to wear. But so they're resenting me for that and this and that. But it was so uncomfortable. It was like I had to sit for a few months with 2 books sitting under my armpits and I'm a shorter guy at a bar leaning. And that was fun because I didn't like sitting there anyway. But now not only do I have uncomfortable polyester pants on, I have this horrible bodysuit. I was like a Scissorhands. In Edward Scissorhands, he wears that corset situation. Maybe the corset would have helped me not to break my vertebrae. But anyways, the cherry on the Sunday of the whole story was before this thing was even made, someone had to come to the house and make a mold of it. You can't there's not a one size fits all with prosthetics or whatever the hell it is for this thing, this flesh colored thing. This flesh-colored torture corset to keep my back straight enough that it would heal. So he comes to the house. It was a guy. He probably was like some sales rep. I don't even think he was licensed. I don't know. He comes to, and I remember the cold feel of the clay, whatever, going on my body, and just my flesh jumping. And this is a bigger kid. It was embarrassing. And at the end of the day, when it was all said and done, it's like, oh, your thing's ready. And it was my exact shape. It was my exact shape, love handles and all, my adorable little 12-year-old body. And it was absolutely devastating. And I never forgot that. And that was sort of one of my first real experiences with the doctor, sort of a specialist, something over and above getting a flu shot. My pediatrician was phenomenal. He was such a funny, wonderful, warm person, and you remember him for that. And so anyways, I guess my point is, if Frank were around, if my dad were around, would it have made a difference? I don't know, maybe. Sure, probably. But it was in many ways, a medical comedy of errors. And it worked out. My back healed, thank goodness. And once in a blue, I'll still have love handles once in a while. They come back, they go away, they come back. I go up and down like De Niro in the late 80s and early 90s with weight, but whatever, whiskey and puddings. So anyway, Dr. Farshad's a fantastic human being, great person. I try to only have, I know you're going to say, oh, he says it all the time. I don't care, because I only want to have people on the show that I like, that I think are good people. So mind your business. And if you're, not a great person, I'm probably not going to have you on. So that's it. We had a great talk. Farshad, just a little bit about him. He's a board certified general surgeon and colorectal surgeon. He's been practicing for 17 years. He's a private practice known as the Heritage Surgical Group, a group of general surgeons. He's the only colorectal surgeon, chief of the Division of General Surgery, vice president of the Department of General Surgery, Pascack Valley Medical Center. He's a father of 3 and has a wonderful wife who is a nurse and a great, great person. And he's really just a great guy. He plays music, he skis. You'd be lucky to know him, really and truly. So, Dr. Farshad Mansouri, coming up on The Fatherless Cheat Sheet. Check it out. All right. See you soon. Okay. Welcome, Dr. Mansouri, Dr. Feelgood, Dr. Farshad, the good doctor. Thanks for coming.
How you doing?
Good.
Yeah, my
doing
pleasure.
great.
Thanks for having me. Thank
It's
you.
so nice. It's so nice to have you here. And I think what you do is really, really important. You are one of the most well-rounded doctors I've ever met in terms of your accomplishments, but also in terms of your bedside manner and your just sort of general calming effect that you have on people. I'm not a patient of yours. I'm a friend of yours. I'm not sure why you're slumming it with me, but anyway,
Well, that's
we'll
just
talk
the
about
thing. I mean, I need people like you in my life.
Well, we'll talk about that later. I have a couple of numbers of psychologists that could get to the bottom of that. But thank you for coming on The Fatherless Cheat Sheet. Very, very excited to have you and talk about some stuff that maybe is a little surprising in terms of the topics of the show. But first, I've been wanting to ask you this question for actually a really long time. You're a colorectal surgeon. You've had 17 years experience. Can you say with at least a modicum of confidence that I'm the biggest asshole you've seen up close?
I've had a lot of experience in this field, and I've seen a lot of assholes. I'm willing to admit it. And you're on there on the field of assholes that
I'm on
I've
the
seen.
spectrum of large
You're on the
ones. Yeah.
spectrum of assholes.
Yeah.
You're definitely
Yeah,
one
I
of the better
sure
ones,
am.
though. One of
Thank
the
you. I
much better
appreciate
ones.
that. And for the record, I'm not a patient. We're talking metaphorically and behaviorally,
It's
guys.
true.
The thing I wanted to have you in about the most was something I constantly think about. When you see families, groups of families, you often see modeled behavior. What I mean is you can even observe that from an outside perspective. If I see dad's got a CrossFit shirt, mom's got that pair of Lululemons, rocking, the kids, everybody's fit. There's that pep in their step, they're fit. If it's, maybe a heavier quartet, maybe just getting out of that China buffet, they're a little oblong shaped. I'm not judging. I'm just saying it happens. There's a thing where, you model the behavior. And so what I was thinking about quite a bit, and I know you were the guy to talk to, more than just the from the colorectal standpoint, from the GI standpoint, just the medical standpoint. Do you see any themes or patterns when there isn't maybe a familial basis there or strong foundation, when potentially the father is missing specifically, because that's what our show is, that it sort of it equates to a lesser attention to caring for your medical needs proactively and treatment wise?
Yeah, I mean, definitely you can extrapolate that. You can, if you don't have the person to look up to directly see their actions and see what the reaction is to their behaviors, then they're going to be left to their own, literally their devices. And unfortunately, these days, too much on social media is going to sway people in the wrong direction, and then just the algorithms just trap them. And so I definitely see it in better with families, and even not even necessarily even surgery, but also just friends and their parents, and friends and their kids, and seeing what their kids end up being. And but I also see it in the medical field too. I see people just making poor diet choices and just not living life to its fullest in the way it should be, and just going down the wrong path. So yeah, definitely having that person to look up to follow, and you know what to eat, when to exercise, should we exercise, when to, how much, and reading and studying, and keeping abreast of what you're supposed to be doing in school, and just being taught lessons, of
Yeah.
of basically how to grow up and become an adult. Definitely.
Yeah. Yeah. And I think there's a second piece to this that I was thinking about quite a bit, was the level of comfort that one has with a physician. And I know it's more challenging now than ever with the demands of insurance companies and things like that. That's stuff I don't know anything about. I'm not going to even ask you about. It's not what we're talking
That's a
about,
whole
but
nother podcast.
right. It's right. It's a whole
Probably two
different
or
show.
three.
It's right. But there are challenges for doctors. I'm not passing the buck to doctors, no pun. I'm not passing the buck to doctors and saying, well, you just carved out 5 minutes for me. But there is a challenge on both sides. Is there relation to the level of comfort someone has going to a doctor about something as sensitive as what you do every day as a colorectal surgeon, in that thing with that familial support as well.
I mean, yeah, if you saw your mom or dad going to get those things taken care of and they're open about talking about it, you're gonna feel more comfortable about talking about it.
Hmm.
Like, you don't know what other people are dealing with, right? You I love the saying of everybody you see is dealing with something that you know nothing about.
Hmm.
And so, specifically with my field, everyone's dealing with, abdominal pain or GI pain or, bleeding in their bowel movements, and yet they don't know that countless other people also deal with the same thing. And so it's something they don't like to talk about, don't like to, get looked into and see what could be the cause of it, or is it a problem? They just figure, oh, it's nothing, it'll go away. And then, they're not seeing it themselves. So they're not gonna feel comfortable bringing it up, even with their primary care doctor, or as you're growing up, your pediatrician, and, or even talking about it with your parents if your parents aren't talking about it with you. Being open and honest with your kids, and then making them feel more comfortable about talking about it.
Yeah. Yeah. Why is there such a stigma attached to this? I mean, this is coming from someone who's never made a number two in his entire life. I'm just saying, I'm going to admit that. Is that problematic? If you've never
It's a bit
gone to the
problematic.
bathroom, is it?
You're really
Yeah.
backed up, man.
It's,
It's like
yeah.
it's getting way far backed up. You
Maybe you
should
could
come
give
see
me a
me sooner than
referral.
later.
44, I've never gone to the bathroom. But is,
That's a problem.
why are people so scared to talk about this stuff, especially with a medical professional?
Honestly, I don't know. It's like, their shit stinks. Your shit, what, like your shit don't stink? It does stink. Can we curse on this?
You can curse all you want.
Yeah, awesome. Fuck yeah.
Yeah.
Sorry. Because it's bathroom habits. It's like it's just the way we're brought up. Bathroom
Yeah.
habits are done in the bathroom behind closed doors. You don't talk about it. And, parents don't talk about it. And, as kids are growing up, we're not talking about it. Nobody's talking about it
Yeah.
until you get older. And then you like sometimes get past those things and you realize you talk to one person, they're like, oh shit, I got the same thing. Or I knew someone who had the same thing, and they saw this person, and then that's when the ball starts rolling, like, wow, I'm not the only one who's dealing with this. And maybe
Yeah.
that's where social media does have its positives. It definitely has its positives. I'm not saying it's all bad. So there are, definitely some sites that you can uh, look up on social media of like, hey, is this normal or not normal? That being
Hmm.
said, as a physician, I gotta say, don't go to Dr. Google, because you
Yeah.
get a splinter and you'll think you're dying of stage 4 cancer. So be careful about
Yeah.
what you see on Dr. Google. But yeah, it's just something that people don't really like to talk about. And
Yeah.
I'm kind of happy to have people come to me to be able to be comfortable and talk about everything. They're in a good place when they come to see us.
Yeah. I, I could go a couple different ways. I'm gonna go towards the you of it all because you're here and I like talking to you. And
Likewise.
this, I guess it's not even a question, more of an observation. But I guess why are you so, why do you have such a good bedside manner and disposition, and some doctors don't? I mean, that's a really stupid question, but
No, it's a great question. Why don't all doctors have good bedside manners? It's the worst thing in the world. Why wouldn't a doctor have good bedside manners? Now,
because we're all
I think
wired differently, right?
that's part of it. It's multifactorial. One of them is that we're wired differently. Some Listen, there are egotistical teachers, egotistical firemen, cops, everything in every walk of life. There are people with egos who like to walk around like their shit don't stink. To bring that
Hmm.
back,
Sure.
and so those egotistical doctors, I'd be like, "I don't have time for you. Whatever. This is nothing to worry about. I'll move on to the next thing that I'm actually interested in doing."
Hmm.
I hate those people. I hate those doctors. They're terrible. They shouldn't be doctors, and yet they are. But why are they like that? That's just how they're wired.
Yeah.
The other part of it, which I think is the majority of doctors, and unfortunately this goes back to talking about insurance companies, is that they just don't have the time to sit down and talk to their patient. Because the way the insurance companies reimburse you, they reimburse you for volume of
Hmm.
number of patients that you see, not for quality of care. And they like to say that they reimburse for higher quality of care, but then they force you to document 90% of stuff that's not relevant to why the person's there, just so they can get paid the same amount and pay their
Hmm.
bills and pay their office staff and pay their rent and pay their malpractice and then take money home and pay for their home bills, pay for their kids, right? So they just
Yeah.
don't have the time to spend with you. And unfortunately, that the doctors get the blame for that. But it's, I feel like if you wanted to become a doctor, the vast majority of people out there who want to become a doctor truly want to help people and would
Mhm.
love to just sit with you and talk with you and work everything out so that you're happy and spend as much time as they need to with you. Um, and so I am fortunate in that I am in private practice and I'm able to do that. I don't work for anyone, I work for myself. And so
Mhm.
I'm able to take the time and sit with my patients. If they have colon cancer, I don't want to send them out in the 10 to 15 minutes that insurance companies give me. I want to sit down with them for 45 minutes, an hour. And if it takes longer than that, we're going to take longer than that. And I'll apologize to the next patient. Hey, I'm sorry I'm running late, but this is your time now. So I'm not going to cut your time short. We're going to
Yeah.
talk. So it's
Throw in a
really
free
multifactorial. I think
hemorrhoid
the small
cushion.
percentage are egotistical doctors, but the majority of them do want to spend that time with you.
Yeah. And I'm going to say that joke one more time. You throw in a free hemorrhoid cushion for those who wait too long in the lobby.
Wait, what'd you say? Sorry, it cut off a little bit.
Okay, I say it one more time. We'll
Say
cut
it
that.
again.
Uh, I said, and for those who wait too long in your lobby or the waiting room, you just throw in a free hemorrhoid cushion.
That's good. I should do that.
You should do
If you
it.
wait more
You
than
should do
30
it.
minutes to see me, you'll get a free cushion, a
You
free
get a
donut.
free cushion, a free donut. Because honestly,
I love that.
what's more valuable than sitting comfortable? I mean, if you
You
can't,
know,
I'm not making
nothing.
fun of it. That's a terrible affliction. If you can't, like, if you can't sit down comfortably, that's the thing that you have to do to be comfortable is to sit down, right? You sit down in
Yeah.
one motion, you pick up the remote, you throw the TV on. And if you have something that's stopping you from doing that, like, one of those
Yeah.
things,
It's misery.
that's a real
It's
problem.
misery. Yeah.
Um,
I wish people didn't wait so long to come see me. They deal with
well,
misery for a
that's the
very long
thing.
time.
But why? So why do people wait so long to come see you? Is it embarrassment? Is it
Yeah.
just put a scare?
Essentially,
Is
it's
it fear?
embarrassment.
Is it fear as well of
Yeah.
knowing?
Definitely. It's fear also because they're worried about, oh shit, do I have a cancer? Do I have an
Mhm.
anal cancer, rectal cancer? Am I
Oh,
bleeding because I have colon cancer? And so, yeah, there's definitely a component of fear, and they kind of push it off and push it off. I see that way too much.
mhm,
And then a large component of embarrassment. Um, and that's where we are. That there also has to do with access to care
mhm.
and, the
Sure,
ability to see
that's a
someone. So
yeah.
that's part of it
Yeah,
also.
that's a big part of it as well, is access to care, and not just care, but good care and people who are on board. I grew up in New York City. I remember slicing my foot open, when I was, like, I don't know, 8 years old, and mom and I went to the Methodist hospital, and I'm sitting between a guy with a gunshot wound, and another guy, I think, choked on a chicken bone. I'm not sure what was happening, but I'm like, "No, no, take those guys. I'm good. I'll wait. I'll be fine. I'll be fine."
You remember
But
that, huh? It's pretty
well, I
incredible.
remember everything.
Yeah.
It's
Yeah.
yeah, it's part of the
You're
curse.
lucky.
I remember everything. But,
It's good.
uh, yeah, uh, your point about well-intentioned doctors, I take that well. I think you're right. I think most people who get into the medical field really have an altruistic worldview where they do want to really help people. I mean, you can cut off 5% on either end, just like politics. We're not talking politics on this show, but cut off the 5% on either end.
Right.
And the rest of the
Yep.
people sort of in the middle, yeah, their intention is that. But then you're held to whatever the standard is for the status quo of the insurance situation or whatever. But again, going back to your disposition and what you provide, I think people just want to feel comforted and be assured that, hey, yeah, okay, this could be really terrible, but it's probably not. and it's going to be okay, but we have to take care of this. Now, generally speaking, what would you say if someone listening doesn't have someone looking out for them and staying on them and putting a foot up their ass to say, get your ass to the doctor? What would you say to them? What would be
Pun
an
intended.
impetus? What would be something that you can say to say, hey, look, you got to take care of this. Let's go take care of
Well,
yourself. Self-care.
as a colorectal surgeon, of course, I got to talk about colon cancer. It's the third most common cause of cancer in the country, second most common cause of cancer-related death. So it's extremely common, much more common than you would think. And so one of the first signs of it, or one of the signs of it, is having blood in your bowel movement.
Mm,
So if you're having a bowel movement and you see blood, you have to think about it. Now, don't freak out. Vast majority of times, it's just because of hemorrhoids that can bleed.
mm,
Um, and so it's not necessarily something major. If it happens once in a rare while, okay, fine. And one point I want to get clear is that we all have hemorrhoids. Everybody has hemorrhoids. We're born with hemorrhoids. We're supposed to have them. So just because you have bleeding or you're irritated, it's not because, oh, I have hemorrhoids. People come see me in the doc, I got hemorrhoids. Like, I know that. You've had hemorrhoids
mhm,
since you were born. You're supposed to have them. They help us with our continence. But if you have symptoms with hemorrhoids, like bleeding, burning, itching, then that's something that you'd want to get checked out for. So, but more life-threatening, obviously, is if you have bleeding, but it's not from the hemorrhoids. You can't tell that just from seeing blood in the bowel movement. You can't tell where it's coming from. Majority of times, it's just from hemorrhoids, but it could be from, God forbid, a cancer coming from the inside. And so, if there's one message to really get across, is that colonoscopy has been shown to save lives, and by identifying where colon cancer comes from, which are colon polyps. They're just abnormal growths within the inner lining of the colon and the rectum. And that itself is not cancer, but it can become more and more abnormal and
mhm.
then eventually become cancer.
Okay.
And so that's what we can identify with colonoscopy, or we can identify it before it becomes cancer and remove it. And so the age to start colonoscopy screening is now 45. I think it was 2018 or so, where it used to be age 50,
Mhm.
and they changed that guideline to 45 because we're seeing more and more people in their 30s and 40s get colon cancer. Some celebrities you might know, Bozeman, and who was the other guy? Just Dawson's Creek.
Oh,
Um,
yeah.
that they develop colon
Yeah.
cancer in their 40s.
That's terrible. Yeah.
Yeah, and you know it is terrible, and I hate seeing it. I diagnosed a 38-year-old with colon cancer when I did a colonoscopy one time.
That's,
um Fit guy, looked like he was healthy.
mhm,
And something else to get across is that it's not the most of them are not the majority are not genetic. The majority of them are just sporadic
mhm,
genetic mutations that just happen. That happens more commonly. People who have diets high in red meat, that eat more processed foods, basically just eating like crap, smoke cigarettes, heavy alcohol intake, not the once in a while alcohol necessarily, but heavy alcohol intake,
mhm,
um, just eating like crap. So just because you don't have anyone in your family that had colon cancer doesn't mean that you can't get it. 70% of
mhm.
people who have it have no family history of having colon cancer. And so the age to start for everybody at a baseline is 45. However, if you do have a first degree relative, which means your parent, your sibling, brothers or sisters, or your kid, if they were found to have colon cancer, then you should start at age 40 or
Mhm.
10 years younger than when they were diagnosed. So if they were
I
diagnosed at
see. Okay.
45, you would start at 35. And I just basically it's like I'm the cool guy at the party now because I'm just talking about when to get a colonoscopy. But honestly, I want to spread, I'm just trying to spread the word to everybody that please, please get your colonoscopy, because it just breaks my heart every time I see someone who has colon cancer that could have been prevented, could have been diagnosed earlier. They have more than 90 or 95% chance of cure, if you get it at an early stage. Like, you can cure
Yeah.
cancer. There are ways of
Wow.
curing cancer. We never think of a cure for cancer, but this is a cure for cancer, is identifying it early enough that it's either removed with the colonoscopy or with surgery. You go in there,
Yeah.
remove it, reconnect two healthy ends. You don't need a bag. People worry about having a bag. Um, you know, I just want to get people in early enough. And so my point is that if you're seeing blood in your bowel movement, most commonly it's from hemorrhoids. You're probably constipated, having really hard bowel movements, and you're probably straining, pushing a lot. So therefore, in that case, have more fiber in your diet, drink a lot of water, 8 glasses of water a day, stool softeners like Colace or Miralax or something just to help soften things. But most so, just get in your diet. Stop eating like shit and just eat more fruits and vegetables. You can have the stuff you like to eat once in a while as well, but have the fruits and vegetables. Now, if you're having soft, easy pass bowel movements and yet you're still bleeding, get checked out. Go see your doctor, tell them what's going on. They'll refer you to a GI doctor or a colorectal surgeon, and they may consider doing a colonoscopy at that time, and then go from there. Just don't
Yeah.
be afraid. Everybody's shit stink. We all have the same thing going on. So everybody,
Yeah.
don't feel shy about getting checked out.
Yeah. And I think that's really important. We put up these roadblocks for ourselves, and I think that the piece about not wanting to know what's going on, I think is really prevalent in men a lot of the time
Yeah.
because, worse than odds, at least women are, they oftentimes are pretty straightforward thinking. And I'm not
Mhm.
pandering right now, guys. You know what I'm talking about. Give me a break. Okay. We're stubborn,
No, you're right.
but
And
yeah,
men are far more embarrassed to come see us. I mean, women have OBGYN visits, so they're almost kind of used to it. But men, they
yeah,
definitely don't want to come see me and get that exam.
yeah, yeah. It's a tricky thing. It's a tricky thing, but I think if you look at it like the self-care piece that you mentioned, and just the fact that you can fix it. You can cure it. God forbid something happens. I think that's the most
Hmm.
important thing because as I will beat the drum on this one, it's like time is the commodity. Time is the
Hmm.
commodity. That's all we have, generally speaking. And um, so it's really important, I think, to stay proactive and to get a little bit of that information. Some inside baseball from you is really helpful. That's really why I wanted to have you on, for some of that inside baseball. And the way you deliver it is very disarming, which is great, it's really nice. What
Nice.
Just to go back to what you were saying real quick about Chadwick Boseman and Dawson,
Uh-huh.
which is so terrible. I saw a picture of him today. He looks super thin. It's
Yeah.
sad. And I just hope he
Yeah.
bounces back. But he's got a few kids. But and tragically, Chadwick Boseman,
Hmm.
that breaks my heart. But
Yeah. Hmm.
why they're both fit guys? I don't. I guess why the now that it's coming on so early in people.
I think I see it from our diets. I think it's from all the
Yeah.
processed foods that we eat. There are foods that we eat in this country that are illegal in other countries. There are
Mm,
preservatives in our foods. There are food colorings in our food that we're allowed to eat, despite them
yeah.
being illegal in other countries. I mean, the food industry, the meat industry, the dairy industry, they're extremely powerful. And
Yeah.
so they basically control what's out there. There's no big vegetable. There's no, there's big pharma. But
Yeah.
there's no big broccoli. It's
Right.
hard to really battle those beasts because they make
Yeah.
it taste so good.
It's
But
good.
what's making it taste so good can
Yeah.
be really bad for you, but you don't know it. It doesn't hit you right away.
Yeah. Yeah. It's complicated because what are you gonna do? Are you gonna start growing broccoli in my backyard? I mean, I
I mean, you don't have to. They do have co-ops that you can, join. And you go, they have fresh fruits
uh,
and vegetables that you can go
I don't I
get
don't do
every
well
week.
in I don't do well in co-ops. I don't. It's
Yeah,
not.
not everyone is available, but I mean, they have vegetables in our supermarkets everywhere
No, I know.
around.
It's just
Where you get
it's
kicked
tough.
out.
And then the microplastics and the whole thing. You think about it, you get it's a little daunting, and
It really
but
is. Yeah.
I guess if you could mitigate a little bit, and get
Right.
organic or whatever when you can. I'm not
Yeah,
exactly
things
sure
that you can
that's
identify, things that you can just pick out as a sore thumb that's just
yeah,
uh that you can just knock out, Don't have fast food every night or multiple nights a week. Just keep it to a
yeah,
minimum. And I used to be more so into a whole food plant-based diet.
mhm,
Never been 100% vegan, but when I eat, I try to eat less meat or no meat.
yeah,
Um,
yeah,
Now I have food cooked for me, thank goodness, by my wonderful wife, and so that's where I got the whole food plant-based diet, but we're not vegan. We do eat
right,
meat, but, you can have 5% meat in your diet and still have all the benefits of a whole food plant-based diet. So what
mhm,
if you had 20% meat in your diet? You're still doing a shit ton better than
yeah,
probably the majority of the people in the country. Right, so you don't have to
yeah,
cut it all out. You just gotta lessen it, Just
yeah.
do what you can.
Yeah, I'm still working on cutting out some whiskeys and puddings out of my diet. I'm trying to get that BMI south of the
At the same
border, you
time,
know?
together?
Yeah, it's tough. It's tough. I just
Bourbon
enjoy
pudding?
that. So, well, no, never that. Well, I mean, come on. What am I? Animale? Never. It's
No, I
different.
know.
It's separate but equal.
I know, and you don't have
No,
to cut
I'm
it
just,
out. It doesn't have to be
no,
100%
I
cut
know.
out,
I know.
and
I'm
don't
just
get me
messing
wrong,
around.
obviously, I'm not cutting bourbon out my diet, but it's not, those are the things that you can do. It's just in moderation.
Moderation is the key. Well, that's always been
Right.
an issue for me, moderation. I've never really had much of a restrictor plate, and when I get cooking pretty hot. But,
Uh,
anyways, so finally, I just wanna ask you sort of one last thing, one little segment that I like to do, we like to do on the show, and it's called "My Old Man Used to Say," and, before I sort of explain that to you, you still have your dad. He was a very successful surgeon as well, and I if I can share, I love the idea that he was recently with you in a surgery. Is that I'm not going to get you in trouble with that, right?
yeah.
Because
No, not at
okay,
all. No, no, he's
okay,
still a
I
licensed physician in, say, New
still
Jersey.
okay. There you go.
Yeah, yeah, yeah,
That's
he's
great.
not scrubbing with me, he's just in the room, like other
But
people sometimes, like medical
did he
students are
gently
in the
wash his hands at least just a couple times and to scrub just
Yeah,
gently?
he
Did he give
scrubbed,
him a once
and
over?
yeah. Yeah.
So anyway, so my old man used to say dot dot dot. What is something he used to tell you that was memorable and sort of moved you forward?
Um, I mean, with surgery, he used to say surgery is an art, and that's what really helps me as far as when I'm in the operating room. Sometimes I gotta figure out some complex questions, questions to answer of how am I gonna do this, how am I gonna do that, and how am I gonna bring things back together, and you gotta do it kinda like, not just scientifically, but almost like artistically, but
Yeah,
as a more of a broader thing that he said for me in life was just, just go for it. Like, I can see him in my head doing this, like, "Go for it," "Just
yeah,
do it, just go get it," "Give it
yeah,
110%. Just what you're doing, just go for it, just give it all you got," is what he was
yeah.
basically was pushing me to do.
Well, that's great, and you
Yeah,
obviously did that because you're not only an extremely accomplished physician and surgeon, but you're a really, really solid human being, a great father and husband, and I'm lucky to know you, and I'm grateful to have you in my life, and I'm grateful that you're on the show. And if one person goes and gets that tube, up
go get it.
in the situation, if we were able to do that today and shine a light on something they have going on, make them a little more comfortable about it, I think that maybe this was successful. So I appreciate you.
100%. Thanks, man. Appreciate
You're
you.
the
You have no idea
you're the best,
what you
brother.
do for me in my life. 100%.
All right, brother. Well, thank you very much, Dr.
Hey,
Farshad
man. Thanks
Mansouri,
for having me.
the Fatherless Cheat Sheet. Thank you. All right. We'll see you soon.